Okay, so, oh yeah, here we go. Thanks. All right, great. Um, we have an agenda today, a loose agenda based on our best ideas, and we may at some point have a special guest or not. It's like really we don't know. We don't know. We have no idea actually.
Well,
I would just like to note for you that I'm wearing my Zoria pin. I don't see yours, which means I'm probably more dedicated to Zoria's cause than you
you
are,
know
which
what,
is fine.
Lisa, you are the vice president and the board chair. Um,
That's
so
true.
you should be wearing that. You should be wearing that for
That's
sure.
right.
No, we had like a real, we had a loose agenda today. So we've both been a lot of places. We've been
A
drinking a
lot
lot
of
of
places.
wine.
Yeah.
Bi-coastal. I was in the great city of Atlanta where I live. And listen, fuck yeah, Max. I mean, yeah. So and you were in California, you were doing stuff. So we were gonna rant about our different
Yeah.
bi-coastal experiences. Yours was supposed to be more fun than mine, but mine ended up being more fun than yours. And
Yeah.
then yeah, what else? Well, we wanted to do a shout out. Our friend Susan Clark got a new job.
Yeah. Definitely. She's not even here to hear that, but she did get a new job, so that's great. Susan is going to work with Direct Trust, doing interoperability stuff. I think it's really all I know about her job is interoperability stuff, so that's cool.
Yeah. Yeah. So that's really exciting. And then we may or may not have a special guest who's going to pop in here and sing some tweets for us, which is very exciting.
Yeah, definitely.
And yeah. So, I mean, tell me about how the state got in a fight with everybody about
Oh
the
yeah.
data exchange in California. Tell me about that because that was pretty great.
Okay, so yeah, so my week has been a bunch of events. It started out on Tuesday with the Federal Health Innovation Day. Our friend Stefan Kanya, his big shindig in the various cities that are not Washington, D.C., with all of the federal folks. They had FDA folks and defense, all the various groups trying to be like, hey, come and work with us. We're cool. We're the government. We're cool. Come on, digital health people, work with us. And that was fun. And then the next day was the kickoff of the California Data Exchange Framework Summit that just ended today. And that was hosted by Manifest MedX and by Connecting for Better Health and the California HHS peeps. And I moderated the opening panel, which was with Mickey Tripathi, head of the ONC, and with Marco Misch, who is the undersecretary for Cal HHS, who's working on the data exchange framework. That's the background. And um, it was a little spicy. I gotta tell you, like it was a little bit spicy. There was some people were a little frustrated because basically both in both TEFCA and the data exchange framework, we've been now multiple years of like planning and like working on the SOPs and all that stuff. Um, and we don't have either of them, right? Like neither like Tefka doesn't exist. Humans aren't real. Shout out to those who know. Um, and also the data exchange framework is just like we're like signing people up, but like there's not really any teeth. It's not really a network. Like when is it going to go live? And those are the questions people are asking. They were like, "What is up? Like, what are you doing?" And also, and no offense to my friends Mickey and Marco, but I think they were overstating the level at which they were working together
You think
on
they're
stage.
not friends?
They're both
You think they're
professionals.
not real friends?
No, like like whatever. Like they're both professionals. They're pseudo politicians who are like out there doing their thing, selling the stuff, and I appreciate that. Like no shame, no shade, but also like you
Only tell the
know,
truth, lie.
yeah. I mean, I'm just gonna say like I asked the question on stage. I was like, so if Tefka already existed and was already live, like would the data exchange framework actually have become a thing? Like would you have gone forward with AB 1331 or whatever it is? And they were like, yeah, definitely. And so, but the answer is of course no, because we all know that like states act when the federal government doesn't act. Like that's just like a fact. It's not even like a maybe, it's a fact. And so,
Well, yeah,
I tried to be
California,
nice about it, but I did call it out.
California
What?
believes, like Anthony Leon, who
Yeah.
knows? I was just going to say, California. I mean, if you're going to leave everybody to their own devices, California believes in itself and it is going to do a thing, and it's going to be fantastic. Can we talk about God bless the private sector and how they totally destroyed, in my opinion, AB 133 from ever, or 130 1331 from ever happening?
1331. Yes. So my understanding with because I don't care enough to read all the text is that essentially what is it? 1331? God, who knows? The latest bill that like got ixnayed. Um it was going to provide some more funding and it was also going to move the like authority to manage and like regulate it to CDII, which is a division, relatively new division in California for like data stuff, health data stuff. Sorry, I don't remember your and it also was going to potentially confirm or set in statute or regulation, I guess in statute in this case, that the QHIOs, which is that's like QHIOs are California's version of QHINs, everyone. It's great. We need to find
Ohio in the South.
QHIOs. Basically that those would have to be nonprofit entities. And so my understanding, without knowing all the details, is that it was ixnayed because of that provision. And the problem for that, I think, is that CDII isn't like officially the home of the data exchange framework. I don't really know. I don't care enough to actually know. I mean, I care, but I don't care enough to like spend hours reading through a bunch of regulations. But I think that's what it is. Keep in mind, these are all very like uninformed comments. So there you go.
Well, I mean, that's more informed than I have. As everybody knows, Insena actually works with a great lobbyist in California because it's so confusing we can't even keep it straight. So I appreciate your now local
Yeah.
observations. So now that you live in
But
California,
like tell me why the CDC Innovation Days was better and cooler than seeing people argue about the data exchange framework.
I think part of it, the data exchange framework, to use something from Carrie Pykoch, is not real, right? It is not real. It's not real. It's not real. And who knows if it'll be real. So the CDC, it's got a longer name, Health Data Innovation Summit. It actually was, Anthony, wait, we'll get to that. Can you see this chat, Lisa? You can see, I don't even know how this works.
Oh yeah, I can see the chat. Right. Yeah, we're good.
So the CDC Health Data Innovation Summit was actually pretty cool because unlike the data exchange framework, it talked about things that are real. So that was really exciting. I am very excited, and I think you are excited too, for a lot of the new leadership at CDC. It's got a lot of spice. There was a lot of energy. I was totally into it. People are like moving and shaking and breaking stuff. I mean, I don't know if they're breaking stuff. I felt like they were breaking stuff. Also, I got to be in a panel, so obviously I loved it. It was great.
Yeah.
So yeah, it was a good time. And shout out to my friend and your friend, Big Data Daddy on Twitter or X, whichever it's been referred to. Yeah, it was a great panel. I was on there with him, so it was good. But in something you want to complain about here that we actually have a prepared slide for. A lot of the discussion was talking about at the higher level, like how do we deal with the data we get right across the country for national surveillance, all these things. And many people actually made this comment throughout each session. And they said, yeah, but like, what if the data is shit to begin with? Right? Like, what if it's total trash? And at the end of the day, like,
which is the actual truth, by the way, just FYI. No, like data is really bad. This is one of my things that I really like. I feel very strongly about. Like, data is trash. The end.
All right. Well, let's talk about our personal health information that we are disclosing here on the internet.
Oh my God.
So they were like at the end of the day, there are like actual humans that have to do typey and like put the things in the EHR to make it go and get where it needs to go. And if it's trash data, it's trash data. And you last week, when we were thinking about what the heck we were going to talk about this week, you made the very real good comment that like, a lot of times this data is absolute trash. So this is actually us disclosing our personal health records here from our EHRs, from our physicians. You can't really read it, but just know it says a lot of bullshit. But Lisa, you tell us how it is.
It's mostly bullshit. I mean, so, I just think like, it's annoying to be like in this sort of like policy and like market access world to be like all involved in all these conversations. You go to your own fucking healthcare records. Sorry, I just cursed. And you're like, this is trash, right? Like none of this, like these are the data that are being shared and they are not correct. They are like missing details. They're just full on incorrect. they are like not as extensive as they could be. They're missing important things, or again, they're just like completely made up. So in this case, up at the top here was I had a little minor eye cancer situation. It's probably going to be fine,
Minor,
and
minor.
probably a minor eye cancer thing, and had this happen. And I looked at the record, and for some reason, they allow you to view the CCDA, which is sort of good, but also like bad because you can see what's actually been coded. And it's just like wrong, right? Like stuff they didn't do, like things that didn't happen. And, okay, I complained, and they're going to do nothing about it. Like patients can never update their records. Total BS. So, like, this is what's being shared now. By the way, notice here it says MIPS. MIPS is the Medicare incentive payment system. I am not that old. I don't have Medicare, tragically for me. I really wish I did because it would be a lot cheaper. I don't have Medicare. Just one example of like trash they just like add like a normal copy paste. Every single time it's like put the trash in. Then you just have more garbage in the system. The data underlying everything we talk about is trash. It's like really bad. And you had a thing too. You're allergic to ants or whatever. I don't know.
Yeah, Brittany makes a great comment. At least someone actually logged MIPS. Like at least
they didn't do anything to like actually like improve quality or outcomes. Again, like yes, Brittany, you're totally right. Except for like they didn't actually do anything to meet quality standards. They're like, oh, we did a skin cancer screening. Put that in the list, except for I shouldn't be in the exclusion criteria. I should not be included. I should be in the exclusion criteria for the measure because I'm not on Medicare. A cast built in the sand. I totally agree.
Okay, so mine, I mean, I didn't really know how to do this. Obviously, we messed up the video platform here. We're going to figure it out later, but you can't really see it. So mine's at the bottom here. So I go into shock, anaphylactic shock, when I'm bitten by a fire ant. So as you can see here, someone logged that I have allergic rhinitis. And at the bottom, when I went in, every year for my annual exam, they say like, how are your seasonal allergies? And I said, do you mean the life-threatening allergy I have to fire ants? And then like at some point, someone put here at the bottom notes, allergic reaction, airway swelling, fire ant bite. Like that's all I got. Like that's the correction in my record.
So, in your record for infinity time.
Yeah, right under the
never
whole
going away.
Yeah, no big deal. So I think this is I feel like everybody's probably got an example here. Like so this is trash. It's trash data. It's like no big deal. This is what our nation is running on, our great nation. It's no big deal. As Tom says, a castle built in the sand, no big deal.
Yeah, I mean, here's the thing as well, right? Like everyone knows that I like to shout about like, patients not getting access to their data and the way that like so many doctors' offices have this like policies that are about like not sharing data. And so I hear, the head of the ONC, Mickey Tripathi, our friend Mickey, and all of their staff talking about this work and working on things like no information blocking. And I'm like, and yet the experience for the vast majority of patients is still freaking bullshit, right? Where they're like, I am sorry, because of HIPAA, I can only fax you these data about you. And you're like, are you for real? I don't care about owning the data. We've talked about this. I know that patients don't own their data. I think I have a quote from this like, the employer of the physician owns the data in the EHR that's licensed to the employer of the physician. That's data ownership. I don't believe I own the data, but I know that I have the right to like access and use and direct my data. I'm sure about that.
Right.
And yet every fucking day it's like, I'm sorry, because of HIPAA, I can't whatever. And it's like, are you for real? Stop it.
Well, I think so just so everybody knows, this is basically a live version of the Marco Polo chat that Lisa and I have, and we would be doing
totally.
Anyway. So as Lisa knows, about once a week, sometimes, this week it was been multiple times, some organization accuses me of violating HIPAA on behalf of one of my clients for whom I do many data agreements. And then I end up in like a lot of these cocktail conversations where someone is like, no, like you're violating HIPAA by sharing data. And I was like, do you even know what you're talking? And so I get in all these fights and it's like totally fine. But like what people don't understand is that data use rights are assigned at the facility level. So like, yes, like as a patient, yes, you have the right to access your data and like do stuff. But the people who assign your data use rights, I don't even care. Like doesn't matter, across the country is your actual provider office, the employer of your physician. And that is so
The
frustrating that no
corporate
one.
employer, the corporation that employs your physician, which in most cases is now like the majority of physicians in the country, just to be clear.
Yeah, total
Like the
bullshit.
idea of like an independent physician, I love it. And I have had so many great primary care physicians who were independent, and those days are coming to an end tragically. So there you go, right? They're employed by corporations. Those corporations have a big license with usually Epic, and that's where your data is, and you do not own it, tragically.
Yeah, and those organizations, they sign a data use agreement and it goes out. I just like ranted about this on the LinkedIn earlier this week, and I do not think the average human, even in health technology, understands how many outbound feeds the average healthcare organization has. It is like, I'd say in like most cases,
A
it's
lot.
dozens. Most cases, it's dozens. Some of them have hundreds. Some of them are sending data even after they've terminated financial agreements with a vendor. Like they're just sending it, like just sending it out, you
Just keep
know.
it going, keep it coming.
And so it's super frustrating for me when someone's like, and I'm like, you don't even understand the internet. Like you don't understand how it works. So it's very frustrating. It's kind of rough. I'm exhausted just thinking about it because I had 3 different comments this week about that. And then, I mean, like I have
Yeah.
a talking, like I'm like, okay, like you can't, like, I actually did get really mad at one point. Last week I got really mad. Like I almost like kind of lost my shit. But normally I have to just be like, let me explain to you how this works. And then usually it's fine. But
Well, none of this goes into actually like making stuff work better for like patients or even for providers or for anyone doing public or population health work. And so, that's the part that gets me really like fired up is I'm like, what are we doing actually? Like, are we always checking like how this is actually helping patients? And then now let's talk about like health tech, which was the whole like conceit of our show, health tech and digital health. My like working thesis forever is that like none of these digital health tools, none of the payers and plans who are thinking about health technology really have very well developed data models or strategies, right? And I just like I've seen it so many times, and obviously I can't like talk about how, but secret things in the past with different clients of mine as a consultant or different things I've been able to access or be subject to. Like they're not using real time or near real time comprehensive data about people to deliver them better care. That's not happening. And I
to
just like
deliver
I feel like we have to keep reminding
care.
people of that. Deliver any care.
Yeah, no, I am in alignment. I think people kind of forget like how we actually have to do stuff, and that is frustrating. We need some levity here, so we're going to talk about the stupidest job posting of the week that we've both seen. Right
Oh
here.
yeah, that's great.
Yep, no big deal. So let's hold on. I was supposed to get our videos up here at the same time. It's no big deal. Hold on, we'll figure that out real quick. But yeah, so like Lisa, you found this job posting. I think you felt pretty great about it. Let's just like talk about it.
Listen, okay. So first thing to know about like anything business related is that like there's a lot of money in the world, a lot of capital in the world just sloshing around looking for a place to go. This is a great example. So these guys, no offense, I don't know them from Adam, so to speak. But they got a bunch of money during the COVID high times, COVID lab high times, when everyone was like creating a new like COVID lab company that was gonna like process your COVID samples faster or whatever, and in a digital way. They got some money and they put it in their bank account and they sat on it. And as you can see here, they are debt free and have a war chest to build on. That's exciting. First of all, this job description is extraordinarily vague. It's like someone to get us coffee and also do operations. And how you know that is because they say COO Barbie would be a strategist, but also a get things done kind of person. No thanks. Strong no thanks. If your team is a bunch of dudes who think this is cute and funny and a great way to attract a candidate who will get you coffee and also be your COO, I'm not into it.
Yeah, bullshit. Yeah. When you sent this, I was like, who is this? Do I remember this company? So like, I was part of the Salt Lake Mafia for a little while, right? No big deal. And so I remember like hearing about this company and like honestly thinking that they went out of business. And then when you sent this, I looked it up and yeah, they were one of those like the opportunistic COVID organizations. And then
Damn. Do you guys ever think about HIPAA?
Yeah. Anyway, so like they did this thing, and then I was like, "Oh, good lord!" Like, oh my, whatever. So anyway, we should probably do that every week. We should find the stupidest job posting on the internet, and that is definitely the case here.
I think we did it here. We found it for sure.
We found it.
I just, yeah. And here's the thing, right? Like, okay, if you're looking for someone to like define your business, the person is a co-founder and they should get like founder equity. In this case, it sounds like they're looking to find someone to join their like existing shenanigans and probably not be that. And so, I would just say if you're looking to like diversify your team, think about maybe making actual space and giving ownership up, not being like, I will hire you. And yes, Ruben is Knuff. I agree. I'm Knuff. Anyway, I ranted a little bit, like, I just don't want to see someone like actually giving up some of their like actual ownership or power if they really want somebody to do this kind of thing for them. So,
So, like, here's the other thing. Like, we got a special guest here. Here's the other thing. If you are posting for your COO on the LinkedIn and you are a war chest company with all the dollars, I feel like maybe you want to use an executive search firm. Just saying.
Yeah. Oh, definitely. For sure. Yeah. Also that.
Yeah. All right. We got a special guest here, Brendan Keeler, who showed up to our talk show. So Brendan Keeler posted this great thing on the internet the other day. And this is him. This is him and I guess his twin. So I saw this after meeting him at Health in person for the first time. And I saw this on the internet. And Lisa, I was like, holy shit, am I still drunk? I am so confused. Did I even meet him? What happened? It was pretty rough. So anyway, everybody
was still drunk, I think.
Yeah, I don't know. It was, who knows? But anyway, so I saw this thing on the internet. So Brendan, I was at this CDC thing and I'm under 4,000 NDAs. So I'm not going to tell you who I was with, but I was with these people, like these fairly important people at a dinner. And I was also drinking wine there. So it was taking me back. And one of the guys was like, let's just connect every hospital with the fire. Legit said it that way. And I thought of your tweet thread on the internet, which I have poorly pasted here on the left. And I would just like you to talk about it with our amazing audience and maybe sing it. I don't know if we're going to do that, but it would be great if you did.
I don't know. I mean, I love karaoke more than anything. We can do it in Health this year if you guys are going, but this is not as lyrical as most of the songs that I go after, but yeah.
Wait, what is other people probably know this, and I think we have some people in the audience who knows. What is your specific like can't go wrong karaoke song?
You can't have me spoil it.
Is it going to be on display at Health?
It may
or
be.
Anywhere else you go. Yeah.
This is an atypical one. I'll just tell it. I don't know how many people are watching, so it's Feliz Navidad. Because it's timeless. It's something that it hits hard. People don't expect it. So, and there's very few lyrics. So you can just like focus on nailing them.
What's your karaoke song?
You would?
What's your karaoke song? Do you even have one?
Me? I don't think karaoke. Sorry, Nadine. Woo! You'll never get me.
Nadine's in the chat, so she might have to bust in and maybe she'll sing.
Like, this is BS.
Our karaoke queen. Yeah, our karaoke queen. Yeah. Yeah. But anyway, so this Colin also works in healthcare. He works healthcare adjacent. He works for Kiva Brands, which is one of the largest marijuana brands in the nation. So health adjacent in some ways, and that's why he happened to be in Vegas for an entirely different conference last year. They can host
healthcare for Kat, so that's fine.
But yeah, he's great.
The brother works in the marijuana business, the cannabis, the medical cannabis, or the not medical cannabis. I don't know.
What's that?
What do you do? Tell everyone what you do if they don't follow you on the internet.
Yeah, no, I tweet. No, just kidding.
Oh,
Um, no, I work
or a
for
living.
I work for Flexpa. Flexpa is a healthcare interoperability company focused on claims data with patient authorization. So we help everything from Medicare brokers, payers, and a variety of other use cases, value-based care organizations, enable different things with claims data. And then I
A
also write.
Portlander, a
I'm, I,
Portlandian.
yeah, I'm based out of Portland, Oregon, originally from New Jersey, but have migrated across the country as one does, and enjoy coffee and beanies and all the things that Portland people like.
Perfect.
cool.
Okay, let's get to your beautiful tweet. Give it a go. You do not have to sing it, but you do have to tell it to us.
Yeah, no, I mean, I think Kat sort of got at the like underpinnings of it, which is everyone says like, oh, fire, it's fixing everything. It's going to it's just gonna it'll make interoperability like that. And the problem is that the human nature in general is towards entropy, and so all the ways that people can f up things, all the ways that they can interpret things differently, any room for that's not strictly defined, they'll they'll find a way to do. And so, um, dealing with 200 different payers at Flexpo, I just decided, like, after getting really frustrated with hearing that Fire fixes everything, to list them all out. And yeah, they're as simple as really obvious ones, like maybe you're using a code set that's ICD-10 and I'm using ICD-9, and that's different, and there's lack of interoperability. That would be wild. I don't know who's using ICD-9, but just using that example of code sets and code systems. But things like the structure of Fire, filling in optional fields, all that, it adds complexity. And then you get to the
I
really
hear this
stupid
is
shit.
called semantic interoperability, and
You
that's the problem.
Yeah, I mean, that's like those are semi-solvable ones, but then you get to people who argue about like underlying really solved problems like HTTP, the standard, and what's right or wrong, and it all compounds. And so I think I listed like 10 or 15 different ways that we've seen payers and other servers implement Fire and thus necessitate, like, what's the French word, raison d'etre, like the reason that FlexPay exists, or and others like FlexPay exist, is just variation and trying to deal with it. And so Fire fixed it. Fire helps, right? Because without Fire, they'd be speaking entirely different languages, but all the regional nuances, all the different ways that the accents on Fire that people can speak are what makes it really hard. So yeah, I'm bullish and I'm hot on
Yeah,
Fire, but
I love it. I'm on fire. No, but what I would say is, yes, all of those things, and also like just because you make something available per the legal minimum, like you make a Fire feed, you make an API available, does not mean that anybody is actually ingesting it and using it. In addition to all of the like really great points you made here, I think there's also just like, and so what? Like it's actually already the law in some of the segments of, the healthcare community broadly. And yet like that doesn't mean it's going to be used without, and here's the key, this is where I always get really incensed, without any kind of like real efforts towards implementation and adoption. And that needs like training and guides and challenges and money, incentives and soft mandates and eventually hard mandates. Like it's just like it doesn't just happen because you're like, yeah, we're gonna do Fire. It's like cool, but then how are you gonna get people to actually use it? Good luck.
yeah, no, I
Okay,
A
mean,
bunch of stupid documents.
I don't know
yeah,
how to do the internet super well here. You guys keep talking. The great Miriam Paramore would like to comment on your tweets. So you guys keep talking. I have to figure out how to get her here.
for sure. Well, I mean, to your point, it's like if you mandated everyone needs to make a post office, every
Yeah.
town needs to make a post office, and you haven't figured out what are the roads between these towns, what are the speed limits between these towns, how much mail can go in one direct, like all the rules and governance and things that allow people to actually use the post office to get mail or data in and out in this case, then what the hell is the point of the post office? And so like
the point of the post office.
Should we get rid of it?
No.
Just kidding.
No, but
I'm a
here's
far
the
left.
thing
I'm a far
though,
left
is like,
Democrat.
okay, you really are, but you're a Portlandian. But also, what I would say is that like, cool, and then because we allowed for like open competition on a lot of things, we have like FedEx and UPS and other stuff, and they do, if there was no FedEx and UPS and DHL and other things like that, would the U.S. Postal Service be in a better position? Maybe, but also, some competition is good. At the same time, USPS has to deliver to every person like in any like legal-ish dwelling in the US of A and like territories and everywhere else. And so that matters because UPS and FedEx don't have to, right? And there's also a difference there that makes that's the health data utility model we had. That is the health data utility model that you should care about, is getting to everybody on every like stupid road. I grew up in the middle of nowhere, as you know, and like they had to deliver mail to us like on this dirt road. And so that matters, right? FedEx would be like, what? Who? We're not giving. No, we don't deliver to them. Whatever. That's my argument, Kat. She's like, no. Look at her face.
I don't know. No, whatever. I'm into health data utilities and all those things. I'm like totally here for it. 100%. A+.
Very
I'm
believable.
taking a picture of Brendan's twin because it was freaking weird. So we're over here. Now we're talking. Apparently, mobile for speakers is not supported. So we don't know where Miriam's at. She should go and get here at some point. I don't know. Also, Tom had a comment on this, and we gave him a speaker link, and it looks like he's sitting in the park and not able to join the speaker link either. So I don't know what's going on there, but that's fine.
The government has not yet been shut down, so we got to give him a few days before, he's a freelancer. Again, let's just talk about that for 2 seconds here. Government shutting down, stupid, wrong, should be illegal. That's my final word on it.
Yeah.
Stupid, wrong, should be illegal.
Yeah.
They had the chance. They had the chance to fix that a couple of years ago, right? When when Obama had the House and the Senate, and I don't know when we're going to get that again.
Exactly the point that was made to me a few hours earlier today, that you should have taken the chance when you had it, and now see what happens. Should be illegal. Totally ridiculous. I mean, and also, by the way, like, who should not get paid during this time? Everyone in Congress. You're welcome. You do not get paid. Kat, we're about to. It's getting spicy here.
And now he jumps on.
I like to talk about.
Do not pay this man.
No, wait. I am reading some texts from Miriam. You all know Miriam. She's basically my hero. Okay, so Miriam says, "Oh well, mobile not supported. We'll try later." She says, "Tell him I said he nailed it. It was the word optional." That's in bold, by the way. I don't know how she made bold text. "All standards since ANSI X12 had optional fields, which makes them non-standard immediately. For 4 decades, all of the fuckers, everyone."
Preach.
Now we're really getting into the Marco Polo, the redacted Marco Polos.
Yeah. Oh yeah. I don't know. We should have a disclaimer. Dear PR people, we do not know how to edit this video, so everybody who says stuff on here is doomed. Okay.
It is not being recorded, we're pretty sure. And also, we do not represent our employers. It's fine. Nobody knows that. It's fine. No, none of us. We're all.
We're doing it live. We're doing it live.
We're doing it live. Okay, what else can we BS about? Okay, fire. Generally good idea, but totally not going to be implemented, and no one cares about implementation or adoption. Government should not be shut down, but also nobody should pay Congress if they're shutting down. What else? Health data are trash.
TEFCA?
Oh, yes, TEFCA, of course. Okay.
Wait, do you have a list of who's on by any chance?
Does anyone want to talk about TEFCA?
Humans are not real.
Birds aren't
not
real?
Yet. Birds aren't real either. Where's Carrie? Yeah, we need her. Yeah, I mean, what do you guys think about TEFCA? Paul Wilder's on the line also.
Is he? Oh, I saw Paul yesterday. Hi, Paul. Thanks for coming to California.
Yeah, he's here.
So Paul was in California, not at my New York thing? I was wondering why you
That's correct. That is correct.
He told me, I don't know where he's at. I don't know if he's going to send some stuff on the internet here. But yeah, he told me he was going to go to the HealthX thing. And then Lisa sent him a top secret invite to the data exchange framework conference.
I didn't know.
And he said invite only. I think he was like, oh shit. So he went to that instead. Yeah, I mean.
Thanks a lot, Paul. I crushed it
Listen,
in my panel.
Nobody told me that it was secret, and I'm glad Paul came. It was great for multiple prospective, potentially fake QHINs to be at this event, because there's a really critical conflict between TEFCA and the data exchange framework, i.e. you don't need both of them. You don't need both of them.
Why have one when you can have two?
Superfluous.
Why have one when you have two?
Why one when you can have two?
Implementation is everyone's problem. Or what was it? What did they say? I don't fucking remember. What did they say?
Implementation is up to everyone. Implementation is everyone's business, everyone's whatever, which I disagree with. I think the government, specifically our government, all the governments, should be required to care about implementation and adoption. And Paul is confirming to us that he really only came because he's trying to get fancy status on United. He had to get multiple segments.
Listen.
Speaking of segments, speaking of airline status, Kat.
Okay.
Oh my God.
I don't know if you want to talk about this right now, but I don't know if you guys saw the Delta changes to their loyalty program. I don't know if you guys saw that. I don't know if you saw it, but
Killer.
Listen, you guys, I live in Atlanta. I am a diamond medallion, million miler, basically the most important person nowhere in Atlanta, because I'm still number 62 on the upgrade list anywhere, because everyone in Atlanta is the same. So when that came through, I was like, well, I actually wasn't that upset, because if they make platinum cool again, Nadine, platinum will be cool again, then it's okay. And also the Sky Clubs are going to get thinned out. We got to thin out the herds in the Sky Club. Everybody knows that. But yeah, you get 6, Brendan. You get 6. So that's
it's ridiculous.
Trips.
It's ridiculous, but I get what it's supply and demand. But I really appreciate you guys having me on. I gotta hop, but yeah.
I'm sorry
awesome.
You didn't sing. That's okay. Maybe next time.
Next time, I'll work on it. I'll work on it for next time. But
all right. Well, Miriam said you nailed it. High five. Great.
Nice work.
Gosh, how do we get him off of here? I don't know how we do that. Remove. There we go. Okay. Tom, what do you have to say?
Remove.
I got nothing. I'm certainly not allowed to talk about the S word. Yeah. Although I'll talk about previous ones, which is that it's awesome at the beginning because it's like a snow day and all the feds go out to happy hours and it's great and that's actually really good networking. And then you're like, wait a minute, I need money. That if you after like a day or like a week goes by, you're like, wait, my check is going to be less, and I'm actually maybe spending more money. Because I'm going out to lunch, I'm like, running errands all day, but we'll find out.
I only lived through one government shutdown, I think, as a Fed, but because I was at the CMS Innovation Center, they were like mandatory, like for some reason they were considered to be not
exempt,
optional or whatever. And so we just had to work and we got paid. It was amazing. That was all that happened.
Yeah. So high tech was a separate bucket of money. So I was working under an exempt bucket of money. And then I went from like a 13 to a 14 at ONC. And I literally the month I got I guess a promotion to ONC, I also got promoted into a non-exempt job. So I got shut down. I forget how long that one was. That was the healthcare.gov one.
Yeah.
I taught myself how to cold smoke salmon.
Listen, that's fantastic. Here's the issue with the government shutdown for people like me. So after the TSA misses their first paycheck, all the TSA people in Atlanta do not come to work. They call in sick that day. So there was one time that I was in a line to go to Great Salt Lake for 3 hours. 3 hours I had to wait in the TSA line. And so that was really the only time I felt the impact. So
very sad. Oh.
Yeah.
We got a line. Yeah, well, what else was on our list today to BS about before we get to the end of our hour? We had a few things to BS about.
I don't know. We had a lot to bitch about. We were going to talk about if we found any cool companies this week. Did we?
Oh, yeah. Yeah. No cool companies this week, but I think there are a few that are starting to form. So I like what the redesign folks are doing, right? I think they're trying to get more companies started faster and use some of the use some of the shared infrastructure to do that. But, it's tough. Oh, good question from Paul. Does CMS pay providers during a shutdown? I think they do, right?
I'm definitely not giving any answers that could be construed as official.
That's true. That's fair enough.
Seriously?
We can't ask him. We can just Google it.
All right,
I
next
don't
week we'll have
I don't
Tom on. He'll be able
anything
to
that's
say
like
stuff.
mandatory. Anything that's like mandatory, they have to do. And there's a lot. That's why government shutdown is stupid. Is because like there's so many things that are considered like mandatory that they have to do no matter what, and so they don't actually like save money or whatever. It's just a stupid thing that wastes money and time. So that's my answer there. All right, Kat.
All right. I found one cool company. So it's this company called Pear Sweet, not to be confused with a company Carrie and I are talking to that is pear like the fruit. That's like different. So this company actually, they do like value-based care around Medicaid, and they pull in community health workers and 211s and things like that to like make like surround with services that these individuals actually need. And I was like, that is pretty freaking cool. They are more active in states like California, where CalAIM is around. There aren't many states that actually care that much right now, or that's probably the bad way to say it. But I really like them. I think they're very cool. I like any company that's like super into Medicaid because there aren't many of them. And then I met a company called Shatterproof. They're a nonprofit that's kind of like doing a product thing for addiction. And I thought that was super cool. And it's a lot of like, it's kind of like professional services, tech-enabled services type thing right now. But I thought it was very cool. Hey, Tom, is that one of your kids?
Yeah.
So she's like backing out of the room.
I was into it. Yeah, the redesign people are pretty cool. I agree. I like what they're up to. So hopefully they're going to cook up some cool companies. But yeah. What did Paul
Here's
say
Moose. Yeah.
And that's Fern.
No, that's Moose.
Oh, Moose. Sorry, that's Moose. Oh my God, I forgot you have two dogs now.
Yeah.
Sorry.
Yeah.
Sorry.
All right. We're gonna end this with actually reading Tom's horoscope. Are you ready?
There you go.
And then we'll go. All right. Here you go, Tom. This is your
Wait, I
horoscope.
had a company. Okay.
Oh, sorry.
Okay.
What's your company?
WellSky. Have anybody heard of them?
They've existed for a long time. They're not a new company.
Well, I didn't hear like so. There were people really like them. Medicaid people like them. I didn't know that they were like connected to all like the area associations on aging and like the CBO, like connected, like not just sort of like sending referrals out into the ether.
True.
Not other people might like. I was like, oh, you're actually connected. That's great. Keep that up. So I was talking to a Medicaid MCO today, and they're like, we looked at like a dozen companies, and we're into these guys. I'm like, all right, carry on. You go with whoever you like. That's all I got.
Perfect.
Did you actually
for a while, though.
demo? Did you actually watch a demo?
Never. They almost started one, and I was like, no, I'm good.
No demo.
So you kept up your streak of never watching a single company's demo.
Why? I'm not using it.
I'm here for it. Awesome. All right. Here is Tom Novak's horoscope. Oh, it's going to make me allow. There's like underwear ads on this website, Carrie. Okay.
Nice.
Tom, secrets will be revealed under the Aries full moon today, dear Taurus, making it important that you keep a keen eye and watch for red flags, subtle emotions, and profound conversations. This cosmic climate is all about illuminating what you couldn't see before, as the stars conspire to reveal what's no longer working with your life so that you may release it under Luna's glow. And with that,
amazing.
We are concluding our first.
Goodbye. Bye, Moose.
This is fantastic. Thank you for having me.
Woo. No shut.